A new survey published in the Journal of the American Medical Association reveals just how much Americans hate their private insurance.
Nothing new there.
I guess we didn't necessarily need a survey for that. You just needed to have ever dealt with a private insurance company. But I'm curious for your perspective on this. When you do surveys on Medicare for All,
Yep.
you come through 70s, 80% popular. Then if and centrist Democrats love to point this out. But then if you tell people, well, this would require you to leave your private insurance and you would have to join the public plan, the Medicare for All plan, you consistently see a drop. Not a huge drop, say 10 to 15 points, and gets it into a place where Democrats start scurrying away and run scared. And insurance companies, health insurance industry healthcare industry run its entire campaign around that. But that gap is real.
Yeah.
Like when people realize that the numbers do drop. So given the fact that surveys do show that people hate those plans, why do you think it is that telling them that this plan that they hate will be taken away causes some people to say, well, wait a minute?
It's fear of the unknown. I actually think Democrats have gotten better at explaining what that unknown would really realistically look like. And Republicans have no answer for what that unknown would look like if they were to sort of implement their own plan to tinker with the private system or even overhaul the private system. And that's been the problem, I think, for both parties, is that at the end of the day, it's bad now, but people don't want it to get worse. I mean, they understand how special interests will inject their own interests into this process, and that could make things a lot worse for them. If you work in politics, you realize how this polling works, right? You'll ask a broad question, and when progressives claim there is broad support for the progressive agenda among tons of cohorts, even Republicans, especially on an issue like Medicare for All, they're technically correct. When you poll on these broad questions, you do get a lot of support for these things because they sound really nice. And then when you drill down, oftentimes the sort of like asking about practical consequences of them, it's less popular. That's not to say it's entirely unpopular, but it's less popular. And I think that's because they do have this very nice sort of like, the left has this aesthetic benefit, right, of saying we are going to insure everyone. Even Donald Trump capitalized on that by saying everyone will have insurance when I am president of the United States. And that speaks to the power of being able to say something like that. But I still think why this gets unpopular is because on both sides, but since we're talking about the left right now, it just, when you drill down into the specifics of it, it's scary for people to understand or to think about what that change might do to worsen the situation that's already bad.
And I wonder if some of it is a loss aversion in this sense, that say, and people would be hesitant, I think, to voice this out loud. But right now, under the current system where you have everybody hates that's in network, out of network, all this stuff with the surprise billing, and you want to use this doctor but you can't because it's not in your network. But what that also does is, just like it fences you in, it fences other people out. And so only so many people are within a certain doctor, your doctor's network or your provider's network. And what that signals to people is that they're at their service. Like they can quickly get an appointment with this doctor. So they are benefiting at the cost of people who are being excluded. And on some level, people who have that decent private insurance understand that. That's why I say they wouldn't necessarily voice it in that way, because that sounds gross, because you're able to get this appointment because there hasn't been sufficient funding in the healthcare system, and this person is therefore just being excluded. And so then when the person hears Medicare for all, like, well, wait a minute, for all? All of these people? So when I'm competing to get care, I'm going to be competing with everybody. I don't particularly love my care now, I love my insurance now, but at least I know I can get it quickly. And so I feel like that may be driving some of it. And because I think so few people are willing to admit that it's hard then for Democrats to counteract it.
Oh, yeah. And I think that's completely true. And, it's also the sort of issue where everybody, at the very least, sort of like, it's an incredibly tangled bureaucracy, our healthcare system in this country, and it's enormously inconvenient, it's inefficient, but people would be terrified to see that have a wrench thrown in it, because that could, the chaos that they're already experiencing, adding more chaos to it is a threat. And I guess I'm curious from your vantage point here, we've been hosting a really interesting debate from both sides of the single payer legislation in the New York State government this week. If you were sort of in the shoes of New York progressives trying to sell this piece of legislation to voters, not even just to get it passed in the Assembly and in the Senate, if you were trying to sell that piece of legislation to voters, how would you assuage their fears of the unknown? What would you communicate to them to give them comfort supporting a piece of legislation like that?
Well, first I would do it. So they, like right now, as we talked about, they have a majority in both chambers. So you pass it. You have a Democratic White House that has a ton of money kicking around for state and local aid that they can help get it off the ground. You pass it into law. You implement it as quickly as you can so that people start to see the benefits right away. But also, and not just in New York, elsewhere, they need to start investing more heavily in public health care, in public hospitals, and doing something about hospital consolidation and provider consolidation, so that there is more ability for everyone to get the care that they need. Because once people recognize, like, oh, so now I can get high quality care for free, and so can everybody else, well, okay, then I'm fine.
Right. No, that makes sense.
People don't want other people to die, but they want to live first.
Right. It was a shocking turn of events. People are self-interested, and we can't blame them for that. This is a super fascinating conversation. I'm sure we will have ongoing coverage of it, and we'll be watching closely what unfolds in New York. We'll be back with more Rising after this.